Hi, I'm Melissa Taylor, and I would like to talk to you about educators' role in supporting children's emotional well-being. To me, this is the most important part of my work as an educator. Emotional well-being sounds like a self-explanatory term indicating well-being on an emotional level. In reality, it's a bit more complex than that. Cohen et al. Describe it as the developing capacity of the child from birth to 5 years of age to form close and secure adult and peer relationships, experience, manage, and express a full range of emotions, and explore the environment and learn. Emotional well-being also appears in FLIGHT, Alberta's Early Learning and Care Curriculum Framework, as a facet of the holistic play-based goal of well-being, emotional health, and positive identities. Emotional well-being in early childhood literally shapes how the brain is wired, how it physically develops. An exercise called the Brain Architecture Game brilliantly illustrates how this is the case, using pipe cleaners as a building material to build a structure and scenarios that either add protective factors or remove adverse experiences or circumstances. Pipe cleaners, straws that represent social supports, or weights that represent stressors to the available materials at each stage. Encountering adverse circumstances and a lack of protective factors early in the game, symbolically infancy through early childhood, puts the player at an extreme disadvantage for the remainder of the game. Similarly, emotional well-being and its effect on brain development forms the foundation for the development of physical health, cognition, and communication across the lifespan. Having high-quality early learning and care experiences provided by responsive and skilled educators can strengthen this foundation and even help mitigate the effects of stress on long-term development. Since early experiences are so vital to children's long-term growth and overall well-being, early childhood education settings and educators must support social-emotional growth as optimally as possible. One example of the difference between poor and excellent early childhood environments and caregiving techniques is the contrast between long-term outcomes for children raised in orphanages and children's homes in Europe after World War II. Typically, children raised in these institutions had extremely poor outcomes, suffering from severe social-emotional deprivation in a condition called hospitalism. The Emmy Pickler National Methodological Institute for Residential Nurseries, nicknamed LOXI after the street where it's located, stands out as an exception. Children who grew up in LOXI had similar long-term outcomes to children raised in their own families, indicating that they had none of the typical problems like criminal behavior, vagrancy, teen pregnancy, or having their own children apprehended, and so on, that are associated with having been institutionalized at a young age. What was different about LOXI, and what does that have to do with Canadian ECEs in the 21st century? Dr. Pickler was very intentional about applying her prior knowledge as a pediatrician working with families to her work with infants and toddlers at LOXI. She and her colleague, whom she had appointed as head caregiver, were quick to notice that the professional trained nurses lacked the ability and or motivation to learn and put into practice their essential techniques, and they seemed to care more about making sure none of the linens went missing than about the actual human children entrusted to their care. They promptly replaced all of the nurses with people who saw children as people and were able to learn, internalize, and apply the attitudes and skills that were required. There were 4 main principles that applied to the care of children at LOXI: autonomy and independent play, secure attachment to a primary caregiver, an environment that fosters social-emotional learning, including awareness of self and others, and good physical health as a foundation for the other 3. The last principle appears to be supported by Maslow's hierarchy of needs, forming the most basic of human needs, which must be met in order for children to be in a regulated state and be able to learn, play, and build relationships effectively. How can early childhood educators and programs use these 4 principles to support children's emotional well-being and social-emotional development? For simplicity, we will assume that the 4th principle, the importance of good health, is a given. By using emergent curricula based on careful observation, allowing children to lead their own play and follow their interests and internal drives, and employing selective intervention rather than constantly leaping in to coach or guide children's play or solve their problems immediately, educators can support independent activity. Another way to do this, and to encourage autonomy, is to involve children in all of their own caregiving routines, inviting them to participate in whichever ways they are able and amenable to do so. Children grow in self-confidence and develop a sense of self when autonomy and independence are allowed and encouraged. Primary caregiving is not always easy to envision in an early learning environment, but it can be done by ensuring that most of a child's caregiving needs like feeding, changing, soothing, etc. are met by the same consistent educator whenever possible, and ensuring that educator is giving their complete and undivided attention to the child and not just the task during caregiving routines, focusing on building a close relationship. Continuity of care, which is having the same primary caregiver for each child until at least the age of 3 years, or long-term generally, strengthens this attachment and helps prevent some of the stress and difficulties that can arise from caregiver transitions. In the program where I work, we try to provide some level of continuity by having our educators on a 3-year rotation. So every 3 years, each educator will move to the next age group's room with the children who are also moving, or if they're already in the oldest room, they move back to the youngest to start a new rotation. And then each year there's one set of educators who move, so that transitioning children always have at least one familiar educator coming with them. Creating an environment that fosters social-emotional learning means an environment that is physically and emotionally safe, but also appropriately challenging for the age and the stage of the children. Children need to take social risks and experience conflict in order to navigate peer relationships. Educators should allow children to safely experience all emotions as they arise, supporting them through that feeling, helping make sense of it, and where necessary, suggesting appropriate ways to express their emotions without hurting anybody. Selective intervention plays a part here too. Educators should only intervene in peer conflict when asked or when safety is a concern. Clear, consistent boundaries and expectations, predictable routines, and social-emotional teaching all contribute to a safe environment. Using visual supports and directly teaching problem-solving, friendship, and self-regulation techniques can also be effective in creating such an environment, and the teaching pyramid model used by the ASAP Continuum project, which is a project part of the work of GRIT, Getting Ready for Inclusion Today, that largely focuses on helping helping educators implement these practices. So that's kind of a brief overview of how social-emotional learning supports development and what the educator's role is in supporting that. Here we have 1 page of references, and there's a second page of references. Thank you very much for taking the time to watch my presentation.